Welcome to the Dr. Ridwan Show, health information you can use. Our promise to you is to deliver to you health information that is up to date, actionable, and usable to improve your health. At the end of each show, you will have the action tools. The action tools are health messages of health information that you can use to improve your health. Today's show and today's episode is about a subject matter in health that is important to a lot of people. It is eye care, eye health, and vision care and vision health. And with us on the Dr. Ridwan Show is one of the top ophthalmologists in the field of eye health, Dr. Lama Al-Aswad.
Thank you.
Welcome on the Dr. Ridwan Show.
Thank you, Dr. Ridwan.
So Dr. Lama Al-Aswad is an ophthalmologist. She is a board-certified ophthalmologist with a subspecialty in glaucoma and cataract surgery, and we will come to learn about that a little bit more. She is also an assistant professor of ophthalmology at Columbia University with practice at the New York Presbyterian Hospital here in New York City. Dr. Al-Aswad, welcome.
Thank you.
So the first question that comes frequently from our viewers on our website, www.drridwan.com, is the biggest concern of everybody, blindness. What are the most common causes of blindness, and is blindness preventable?
In general, blindness is preventable if you catch the diseases early, but the most common causes of blindness are cataract, glaucoma, macular degeneration, and diabetic complication in the retina. If you catch these diseases early or you control them, you can prevent blindness. And cataract is a disease that you can reverse it quickly with surgery.
So let me take this opportunity to ask you about cataract. I was just reading the newspaper the other day, and it mentioned cataract is one of the most commonly performed surgery in general, not only in your specialty, in the eye specialty. So what is exactly a cataract?
Well,
and I see you brought kindly here, and thank you very much, a model of the eye for education. Thank you very much.
If you think about the eye as a camera, you will know that there are different structures that affect vision. Some of it is the cornea, and if there's a problem in the cornea, that can affect vision. Sometimes in the iris, some changes can affect vision, and sometimes in the lens, which is the cataract.
So just for me to understand, you're saying the camera, the eye is like a camera.
Mm-hmm.
That means it's like a lens and a film.
Correct.
The lens is what you call the lens in the eye, and the film is what you call?
The retina.
The retina. Okay,
the retina.
Thank you.
But in general, the lens could be the cornea, could be the human lens. So multiple factors to it. Think of the camera as having multiple lenses. So what is a cataract? Cataract, basically the human lens, which is behind the iris, the color part of the eye, when we were born is transparent. When we get older, it starts becoming cloudier over time, and it becomes opaque.
Oh, let me see this. So this would be, obviously it's much smaller than this. This would be the normal lens of the eye, and this is if you get a cataract. So you can see the difference right here. So what happens when it gets cloudy like this?
So consider it as a dirty window. The patient can't see outside, and the people outside can't see inside. So having the cataract prevents the patient from seeing. And it has stages. It starts gradually, and then it can progress to total opacity. And at that point, the patient really doesn't see.
Becomes blind.
And this is a natural aging process. But there are diseases that can accelerate the cataract.
Like what?
Cause cataract. Similar to inflammation,
yes,
diabetes, some medications similar to the cortisone or steroids, and sometimes trauma can cause cataract.
So like an injury to the eye.
Injury to the eye.
So how is cataract treated?
There is no medical treatment for cataract. So
you cannot take a pill or drink a syrup. There is no medical treatment.
There is no medical treatment. There are some advertisement for eye drops to reverse cataract, but it hasn't been proven at all that they do reverse cataract. The only treatment for cataract is surgery. And there are different techniques for cataract surgery in general. But the newest technique that most people use at this point is the small incision cataract surgery, which is a close to 2.6 or 2.2 millimeter incision. You go
which is about 1/10 of an inch.
Correct.
So you do 1/10 of an inch. How do you see that? Do you use a microscope?
Usually under microscope. You use
a surgical microscope.
Surgical microscope.
Fascinating.
And it's sutureless, so we never use sutures.
No sutures.
Rarely that we do.
So
but
it heals by itself.
It heals by itself. So you
because it's so small.
It's so small. That's true. So you enter from the front part. You go inside, and the pupil usually is larger. You enlarge it, and then what you do, and I'm going to show you here, you use special instruments to remove the superficial layer, and then you go in with an ultrasound machine and you cut it to small pieces and suck it out, and then put an artificial lens in the same bag.
So once you remove the diseased lens, the natural lens that is diseased, you replace it with an artificial lens so that the person can see?
Correct. And there are different kinds of lenses right now. There are the basic lenses, which you, for only one distance, and then you need to use glasses afterwards, or the specialty lenses that can correct for presbyopia at the same time, so 80 to 90%.
What is presbyopia?
When you get older, patients, when 45 plus or minus few years, they have difficulty reading.
I see.
So they would need reading glasses, and at that point, they use reading glasses. When you do cataract surgery, you put it for one distance, and they're still going to need glasses. If you do the specialty lenses, you can eliminate the glasses 80 to 90% of the time.
So the other thing you mentioned in your introduction earlier, glaucoma. Can you briefly explain to us what is glaucoma and how is it treated?
Okay. Glaucoma is another blinding disease. Usually happens because of disease to the optic nerve, which basically consists of small nerve fiber layers that come to the optic nerve, and they collect and go to the brain.
That's the nerve of vision.
Yes. Consider that similar to the retina, there's the nerve sensation that connects to the brain and sends the message to the brain. What happens is, in most patients, there is elevated intraocular pressure. The pressure in the eye is higher.
So in the eye globe, what we call the eye itself, the pressure increases, becomes under pressure.
Most of the time. There are sometimes glaucoma with no high pressure, and what it causes a mechanical damage to the optic nerve and crushes the nerve, and slowly over time the nerve dies.
From pressure, the nerve gets damaged, and it can cause blindness.
Correct.
And how is it treated?
First of all, it's manifested initially by peripheral vision loss. So most people will see very well centrally. Their peripheral vision will be affected and slowly progresses to the center.
Like looking through a tube.
Correct. And glaucoma is considered the silent thief of sight because it doesn't cause symptoms most of the time. Patients only know about it when it affects their central vision. Now, can we prevent blindness from glaucoma? Yes, if we catch it early, diagnose it early, and treat it. The treatment for glaucoma has consisted of medical treatment. We use certain drops, different kind of drops, to lower the intraocular pressure or increase the flow out from the eye. We can do laser surgery to help the flow from what's called the area that drains the fluid out of the eye, or we can do cutting surgeries, and there are multiple different surgeries for that.
And treating it properly would prevent the blindness from it?
Most of the time. If we catch it early, treatment of glaucoma prevents blindness.
Now, I learned that you, here in New York City, pioneered a glaucoma screening and blindness prevention program. Can you briefly tell us about this fascinating program?
Thank you. Because glaucoma is the silent thief of sight, so most patients don't go to their eye doctor unless they have symptoms. And a lot of patients never see their doctors for 5 to 10 years, and they could develop glaucoma and lose vision. For that reason, we created glaucoma screening programs. We tend to go to underserved areas or out of reach patients who can't afford eye exams. And
excellent. So people who otherwise have no access to care.
Correct. and we take a van and equipment and we screen them for glaucoma. But our program is different in that we not only screen, we treat. So any patient,
if someone diagnosed from the screening with glaucoma, you treat?
We take them back to the institution, do more testing, and treat them. With the help of the Congressional Glaucoma Caucus Foundation, which gives us grants to support this project.
And how long have you been leading this project?
For approximately 7 years, and we've screened so far 6,500 patients.
Fascinating work for a noble cause to prevent blindness. The other question I wanted to ask you is, what would you say to our viewers and to people in general? Should you have an annual eye exam? Is that something that is recommended?
It is recommended to have an eye exam every 1 to 2 years, unless you're a person at risk for one of the blinding diseases. It's recommended to be seen more often according to the physician's discretion. But in general, if you have no disease, it's every 1 to 2 years.
Now, as you know, we receive a lot of questions through our website on www.drridwan.com. And one of the frequently asked questions in eye and vision health is the question about sunglasses. Should I wear sunglasses if I go on summer vacation, go to the beach, or for that matter, in the winter, if I go on ski vacation? Are sunglasses healthy, necessary? What is the story about that?
In general, sunglasses are recommended, and wearing them at a younger age is important to protect the eye from the ultraviolet light. The ultraviolet light can damage the lens and accelerate the cataract formation and can cause macular degeneration. For that reason, we always recommend it. And some people forget that the snow tend to reflect a lot of ultraviolet light, and at that point, they do need to wear sunglasses too in snowy situations.
Very important information, fascinating information, and very helpful information to our viewers on eye health and vision health. Dr. Al-Aswad, I thank you very, very much for sharing with us and with our viewers this important information about your field. And to our viewers, this is Dr. Ridwan from the Dr. Ridwan Show, health information you can use. As we promise you at the end of each show episode, we have the action tools for you. So our action tools for you in regards to eye vision and vision health is make sure you go and get an eye exam every 1 to 2 years. And if you have certain diseases such as diabetes or high blood pressure or others, consult with your doctor. Maybe you need a referral to a regular eye exam once a year. Remember, blindness is a major disabling condition, but blindness can be prevented. Most important causes of blindness include cataract, glaucoma, complication of diabetes in the retina, and macular degeneration. Consult with your eye doctor and come back to drridwan.com.